Centralized facilities we hope are up and running by next week. And as I said, we're working overtime to secure the resources and a resourceful mindset to get those operationalized. In addition to that, as you know, we're still able to send tests out of state and partners with the other commercial lab. And we now have 4 other points of testing in the state of California, with Stanford doing tests now, UC LA, UC San Diego, and the City of Hope. Those 4 hospitals are also providing tests in addition to Quest, in addition to the 18 state labs. We have expectation that as early as next week, Kaiser will start testing, and we're working with UC Davis and UC Irvine to complement those efforts. So we'll go from 4 to potentially 7 hospital sites as early as next week, in addition to Quest, which will go from 1 testing facility in San Juan Capistrano to 2 additional testing facilities, we hope, by the end of the month. So I'm giving you a broad overview of our testing protocols, testing capacity. They are improving, but there's still challenges, and we need to own up to that, and we need to be forthright and honest about what those are. And I'm happy when I conclude to answer more detailed questions if you have them on that topic. As it relates to the Grand Princess, 1,963 people are now off the boat as of last night. We have 511 people that we were able to get off the ship yesterday. We hope by the end of the day an additional 476 individuals will get off the Grand Princess, substantially now concluding the more challenging part of this process. This was the day we had hoped to conclude that process, and broad strokes we have. Save the crew, which we discussed would be quarantined on the boat, and now some foreigners that we're also trying to manage, and that is the cohort that we are working overtime to address. We anticipate that by the end of this evening, 1,075 crew members will still be on board that ship. As you know, a few crew members went back on these repatriated flights to Canada and to the United Kingdom. Not all of them, just a handful of them. We're working with the embassies across the world, but all of them, most of them in the Bay Area that we have been in contact with, the Embassy of Korea, South Korea, Japan, India, Philippines, substantively, to address the needs, not only the crew, but the remaining foreigners that are still on board. We have 3 flights scheduled to Miramar today, 1 to Dobbins in Georgia. As you know, Laughlin is only accepting Texas passengers, not American citizens that are not from Texas. That's disappointing. Folks in Georgia are doing more, and the people, of course, the state of California have always done more. That is not helped in our logistics, to be candid with you, but it is what it is, and that's why there are no additional flights into Texas. They're only taking Texans. They're not taking other American citizens, unlike Georgia and unlike the state of California. We are well aware, as you have all reported, of some logistical issues that have been frustrating as it relates to provisions on the Air Force bases for these passengers that have come off the Grand Princess and have gone to our military bases. We're working overtime and in real time to improve those. But as you know, that's a federal operation. That's not an abdication. But we have jurisdiction on those military sites. But we certainly are strongly supporting those efforts and are hopeful that we'll see a substantial improvement as those individuals go to these sites and are quarantined for that 14-day period. You know that there were a number of people off the ship that went to hospitals. As of last night, there were just 8 individuals remaining in those hospitals. The rest have been sent to multiple sites. 2 sites that we have secured, one Silomar State Park site. We're putting individuals into some of our assets on that state park. Again, there's state parks, and then there are parks that have substantial inadequate facilities. This is one of those state parks with substantial infrastructure and facilities. And we also secured, as many of you are well aware, a 120-room hotel in San Carlos. And we've been working very collaboratively with the county down there, local authorities, and that will provide access for those individuals that were otherwise in our acute care facilities and our hospitals to be transported to these locations. As you can imagine, under our pandemic planning, we're also looking to secure additional assets, additional hotels, motels, other resources. We discussed a few days ago my proclamation of a state of emergency that affords us the opportunity to do that on state lands, fairgrounds, armories, and the like. I'll talk to you in a moment about our executive order that further advances that cause as well. So that's broad strokes where we are with the folks coming off the ship. For what it's worth, we had 4 people yesterday, or rather, excuse me, 5 people yesterday that also went to the hospital. We expect potentially a few more today. Again, very manageable, and obviously we are encouraged by the fact that the original 36, only 8 remain, which suggests their health is much better than was originally assumed, and that's very good news. For those of you that are curious, how many people have come off the ship that have been tested positive? Those tests are happening in real time. We are aware of a number of people that have been tested positive that have come off the ship, in addition to the 21 that were originally tested, 2 that were passengers, 19 that were crew members, 1 in Canada and 1 down in Miramar. But that information's coming in real time. That's all I know about those individuals at this stage. We will be collecting that data and providing it as soon as we are in receipt of that information. As you know, many of these people have just arrived on these sites. We are just procuring not only their accommodations, but their necessities. And once those are done, then they'll begin the testing regime. Again, all of these individuals will be tested, but not all of them have been tested. Again, this repatriation effort from the cruise ship into the Port of Oakland, into these military sites, not just in California, but across the country, Texas and Georgia, is a real-time operation. Once people are settled, they'll be tested, quarantined, and we'll have that information to provide you. We, pursuant to that executive order last night, made an additional announcement, as I referenced a moment ago, related specifically to non-essential events in the state of California. It is not only our strong recommendation, but codified in the executive order that we have directed cities, counties, private, public sector, large and small, all throughout the state of California, to no longer permit large non-essential events in this state. Sporting events, other types of conferences, music festivals, and the like, fill in the blank, and I'm happy to fill in the blank. We believe that was appropriate based upon a number of factors, not least of which our collaboration and coordination with the CDC. As you know, yesterday, mid-morning, midday, the CDC put out protocols and guidelines for a similar number of individuals, 250 or larger for non-essential gathering in the county of Santa Clara. That was just one county. We felt more appropriate to begin to advance that process throughout all 58 counties in the state of California. We've been working with our local partners, and that has been broadly supported. And while it is a directive, while it is a guidance, its legal authority is limited from an enforcement perspective. I know this is a question many of you have, but I have all the expectation that it will be advanced and will be adopted. Invariably, you're going to ask, well, what happens if it isn't? I'm not concerned about that, but I can assure you we have the tools in our toolkit if indeed we needed to move forward with stepped up capacity. We have the ability, the ability as governor to enforce, but I don't expect we'll need to do that. I think people recognize the imperative of this moment and the importance for non-essential events to limit that social interaction and the mixing of different groups, particularly for our seniors and those with compromised immune systems. And in that respect, we have also put out guidelines to limit to 10 the number of individuals in those categories that come into congregate settings, that come into contact with one another. So those are the protocols we put out. Those are the parameters. invariably, I think you're going to see this not only across the state of California, where we have seen this pursuant to our directive last night, but across other parts of the country very shortly. So that includes all large athletic events. That includes, obviously, not just private concerts and private functions, large conferences and the like, but clearly sporting events that would impact not just the NBA with their unique set of circumstances, but Major League Baseball, which is moving towards opening day very shortly, and others. That directive is effective for the rest of this month. We will extend it as necessary, and it's likely it will be extended. We didn't want to put a firm timeline, but we want to give people a sense of what to expect. And we've been socializing that throughout the state over the course of the last 24, 40, 48 hours. It does not include, at the moment, and I can explain, and I will explain why, casinos, card rooms. It does not include right now theaters, and it does not include large parks like Disneyland. I had a conversation with Bob Iger yesterday. We've been meeting with our partners and our tribal nations. We've been meeting with leaders of those respective industries. The complexity of their unique circumstances requires additional conversation, different kind of engagement, and in real time, we're in those conversations and engagement. The reason we didn't do it was because of the complexity of their unique circumstances, but I assure you, we are moving quickly and effectively towards a resolution in those spaces. And again, this is with the advice and counsel, not only the folks behind me, but with the direct engagement of those individuals that would be impacted. They raised enough legitimate concerns and questions in the short run that we felt it appropriate to exclude them from this general order today and advance those conversations with earnest later this afternoon, and hopefully have some clarity and guidelines in the very immediate future in terms of those venues. Final point on the executive order, there are a number of things included in that. I referenced that the issue of finding access to hotels and motels and sites where we can quarantine and isolate individuals, that is ongoing and has been quite successful. We're looking for folks to find similar assets down in Southern California and San Diego area, Solano. And by the way, thank you to the elected officials in Solano. Thank the community in Solano for stepping up, doing the right thing, and disproportionately meeting this moment. I just can't repeat that enough, how proud I am of that community and how complimented I am by their elected representation and their willingness to work with this administration and the federal government throughout. But we do have in this executive order the ability to commandeer existing private sector assets, including hotels and motels. That was one of the directives in the executive order. Another directive in the executive order allows for the ability for individuals that are impacted by COVID-19, the coronavirus, not to face penalty and fines associated with their tax preparation for state taxes. This is not completely dissimilar to the federal rules that were advanced by the president yesterday. We'll do the same or similar rulemaking pursuant to that executive order for state taxes. We also are looking to waive the 1-week requirement on unemployment insurance and the 1-week requirement on disability insurance, i.e. sick leave. And so we have already directed our Department of Labor to do just that, and that, again, was codified in that executive order that was signed last night. Bagley-Keene issues, Brown Act issues, folks at home may not know what those mean. Every one of you knows and understands those things intimately. Those provisions and those appropriate protections for public transparency and accountability to the public are being preserved, but telephonically, through technology, and through other means and mechanisms. We laid those out, a full page of our executive order just lays out the details of Bagley-Keene and details of the Brown Act, but still provide public access, still provide the ability for the public to be notified, but still allows us to conduct ourselves at the state and local level with the public trust always front and center. And so that is another part of that executive order. I can continue, but want to just highlight two additional more substantive parts of the executive order that has to do with the issue of lab testing and scope of practice, and the issues related to EMS and paramedics as it relates to scope of practice, and the issue of being able to get retired annuitants to be part and participatory of this moment and allow folks out of state to come in and be part and participatory to meet this moment. So allowing us additional resources and respect to accessing the state rules in a way that provide more flexibility. So that's broad strokes where the executive order lies, the directive on social gatherings in excess for non-essential events of 250 or more. And we continue, in closing, to work on the essential events. And for me, essential includes schools. Put out directives on Saturday as it relates to schools, and if they do move forward to moving towards the possibility of closures, what those protocols and procedures would look like. As you know, just 2 days ago, we met with all the superintendents to lay that out. All of that is happening in real time as community spread occurs in different counties. Different school districts are impacted differently. Different schools individually are impacted differently. But we do deem that schools are essential, not non-essential. But we lay out, as we did in those directives on Saturday, specific strategies and protocols as it relates to assisting our children, but also assisting our faculty and staff, not just our teachers, in protecting themselves from spread. And as you know, they include, among other things, staggering PE, making sure that assemblies are canceled, making sure that we are providing meals in the classroom or in other isolated settings, common sense as it relates to sanitation and distancing, and trying to concentrate classrooms and not mix them with other classrooms. And that's just common sense. That would extend to the private sector workforce, not just our public schools as well. So just want to be clear on that, because we have seen private schools, charter schools, clearly institutions of higher learning that have begun to shut down their traditional classrooms and have turned online. We, as you know, have that capacity in some districts, but not in other districts. And I'll remind you, 60% of the students in the state of California are in reduced school lunch or meal programs, some breakfast programs as well. And as I referenced, you have some, like Merced, that 80% of that student body is in reduced meal programs. So there is a deep socioeconomic consideration. And in closing, a workforce consideration. If you are a caregiver of a loved one, a police officer, firefighter, emergency room doctor, nurse practitioner, and you have kids, and you have no capacity to have those kids at home without your own presence being there, you no longer are part of then the workforce to meet this moment. And that's why, again, we have to be very thoughtful and considerate as it relates to our education system and the broader impacts, including, if we do close, how to feed these kids and how to protect these kids and make sure they're real caregivers that are there to secure their needs if indeed they are back home. So that's where we are in broad strokes today. I will say this, and forgive me for repeating this, none of this surprises us, and I hope doesn't surprise you. I continue to try to lean in with transparency on where I think we're going, and clearly as it relates to social distancing with these non-essential events, this is where we need to go next, and to make sure we fully implement those procedures and protocols to slow down the spread, to get through a peak, and to get through the next few months so we don't overwhelm our healthcare delivery system, and we can meet this moment, protect people, and do our best to address not just the health, but public safety and economic consequences of this moment. And so with all of that, said, we're happy to answer any questions.
Governor, you mentioned that some of these tests don't have all of the components. Does that mean you can still use them? So do we still have the capacity of 8,000 tests if you don't
Yeah,
have all
we have 8,227 tests that we believe we have the capacity to conduct. And we are distributing those throughout our system, not just the state labs, but these local labs. But there's 18 labs in that system currently. 19 labs are in possession of test kits. 18 are currently utilizing those test kits. To the extent there are backlogs in certain local labs because they don't have all the components, we have already engaged Quest to then begin to test those backlogged kits to the extent they don't have all the components. As of this morning, we do not have any backlogged tests. So it's a way of reinforcing that currently, because of the partnership with Quest and the nature of how we're distributing all of the ingredients, not just the traditional kits, that we currently are meeting the demand. But again, that demand is limited by the protocols and procedures that are in place. And that's why I want to say again, our intention, giving you a sense of where we're going, is to centralize our testing capacity, to partner with our counties, and to provide facilities where we can access substantially greater number of tests with all the component parts in partnership with Quest and other hospitals and labs throughout our system, including outside of the state. And those protocols and procedures are being put in real time. Again, 2:30 today, we have another follow-up meeting, and we'll be announcing in detail what those look like and how you access those. So to not be yet the drive-by facilities that you are seeing, and many of you reported about in South Korea and elsewhere yet, but these will be stepped-up capacity for people that would allow us to bypass the current restrictions on testing that are in place today.
Governor, to what extent is the limitation on testing a result of like lack of funding for county health departments? Is that a factor here?
To my knowledge, that's not a factor. We're well-resourced, and to the extent that any lab and county is in need of additional resources, we are in constant contact, and we'll provide those resources. Look, from a cash-based perspective, this state is in a good position to meet this moment. We have the support of the federal government, the $8.3 billion appropriation. Obviously, they're loosening up additional access to resources on the UI, and hopefully in the paid sick leave space. That will only further our efforts. We're in the beginning of our budget year, so the agencies and state departments, including local, have not expended. They're not at the end of that fiscal year cycle, so we feel we have ample resources.
So why is Quest Labs able to come in and provide the reagents and the personnel then? Like, why don't the county labs have those?
Well, that's an issue that we have expressed very publicly and privately, and it's an issue that needs to be resolved quickly. And I was very clear about that 2 days ago with all of you. We've been very clear with our federal partners, the incredible importance of making sure we have all the components of testing, and that we are provided those in real time. Quest and other commercial labs, this is all they do 24/7. And in many of these labs, including the 2 that will come online by the end of the month, particularly here in California, these are automated tests. In essence, it's all-in-one kit that then allows them to move forward. Otherwise, it's separate components. These are more automated systems. As part of the after action, I assure you I'll be standing here, hopefully in a number of months, talking about what occurred and dust settles and ways to improve. This will be an imperative for the federal government in partnerships with states and municipalities, large and small, across the country to address going forward, so we're not just reliant on these commercial labs for these completely integrated tests.
Can you, and then there, a woman in, as you know, a woman in an Elk Grove nursing care facility was one of the people who died from this virus. Has everyone in that facility been provided a test? Do we know that there aren't other seniors in that home?
Yeah, all of them. Well, we're monitoring all of them, and Dr. Galley could talk more about where they are in the protocols of testing.
So we're working closely with the facility, first and foremost, to make sure that we have eyes on all the residents, making sure that the staff are taken care of as well, because we know that this is a vulnerable group susceptible to severe disease, and our first and foremost priority is to ensure that they're getting the care that they need. Additionally, we are working to make sure that those who need testing, that we have it available, and are working with the facility to determine who will get tested very soon.
Are there concerns that like an employee from that facility might have spread it to the surrounding community?
Certainly. I mean, we know that there's widespread transmission, right? So what we are certainly focused on is ensuring that people who have been in that facility are given all the guidance that they need to understand how transmission happens, to keep away from people in their community that are also equally susceptible, that they if they develop symptoms, that we get them the care and testing that they need right away. And this is certainly a very important moment for California, one of the first facilities that takes care of older Californians with a case and in fact a death. That we are taking it very seriously to make sure that we lead and lean in and under the governor's guidance to really push forward and make sure that other facilities, that we're very vigilant in making sure that not just residents but staff are given the attention that they need.
So why only test people if they show symptoms, staff and residents?
We are working on the protocol right now to determine how many we can test right away. I expect that we'll be testing almost all of the residents that are in that facility, not only because it gives us an opportunity to make sure those residents are safe and protected against COVID-19, but it also creates an opportunity to understand in a facility such as this with one known case with a pretty significant mortality outcome, how many people are in fact infected, and it helps us do what the governor has been asking us to do, which is really get in front of surveillance. This is sort of a targeted surveillance moment as well.
What about
Governor,
visitors
when it
coming
comes
in
to
and out?
testing kits, just to understand, did we know that the other tests that we were getting from the federal government did not have all the pieces, and we just wanted whatever we could get to match with what we?
Not in the beginning of this process.
Okay, we didn't know that they weren't.
Not in the beginning of the process. Yeah, and it became clear when we had some ambiguity. We were referencing the number of test kits, and we were then getting queries back from some of our local labs saying, well, we can't use these test kits. And then obviously it led to a series of questions and then deeper understanding of what these kits were and what they weren't as it relates to the reagents, as it relates to the RNA extraction kits that weren't always a component of the tests that were being provided. Again, the CDC is well aware of this. We've made it crystal clear. I had the conversation with the Vice President directly, individually, yesterday morning about this, and they're working real time to start providing them. But again, the good news in this respect is concurrent to those conversations to address those gaps in those testing protocols, the commercial labs are now coming on board. And as I noted, they are substantially advancing our efforts to test comprehensively. 1,200 tests on Tuesday, 1,200 tests on Wednesday, 100 tests, just to put in perspective, on Monday. So they're significantly ramping up capacity when we open that West Hills site, the Sacramento site, at the end of the month, or by the end of the month, of getting as much as 5,000, potentially 5,500. Interestingly and importantly, those tests are not just for California residents. I don't want to mislead you. Those tests roughly today are about 50% of California samples. These are testing labs that are absorbing people from out of state. Accordingly, we know doctors are sending tests out of state individually to commercial labs for the benefit of California residents as well. What we are putting together, and we'll start providing this information, is a aggregated number. I gave you the number of tests we've done to date in terms of the 1,575, but we have now, with these hospitals coming online, not just the labs coming online, we are going to have to collect all of all that data and begin to report that. And as we increase the number of testing facilities, including these congregate sites and these community sites, the testing numbers are going to start increasing significantly.
You talked about confirmed cases. Do you have any numbers on the people who had the coronavirus and are now healthy?
I'll leave that. Dr. Angel, do you have that information?
We don't have the complete information on the resolution, but we are following very closely when people are getting into trouble, when we have people in ICUs, et cetera, and following those courses.
So no confirmed number on resolutions.
Not at this time, no.
Governor, you mentioned that these tests are something we're gonna be reflecting on in a couple months and talking about these test kits and parts we don't have.
Yeah.
So I'm curious if what you're saying now is that because we don't have all of these parts, that we're having a limited ability to test in some areas, and like, what is your greater concern about this?
My greater concern is we could be testing a lot more people in the aggregate. And obviously, it's our intention to prioritize testing so we have a sense of what we're dealing with. It's a critical component in all of this. It's just a component that's been lost. We talk about test kits. It's more complicated than that. And forgive me, make something complicated, but this is profoundly important part of the conversation we're not having nationally about the tests. They are now having those conversations, and as I said, we can lament about it, we can focus on it, or we can recognize that we're addressing it, and we have these new commercial labs, private hospitals, and others that are now helping supplement that. And so I feel more confident as we move forward in the next days and weeks, including these community facilities, congregate testing sites that we intend to open up, that we'll get through this. But it's just a component that explains why you get calls from local labs saying we can't test, and I'm here at the podium saying here are the thousands of tests we have in the state. It is, both of those things have been true, and the ambiguity lies in looking at the totality of the ingredients that often is not universally supplied.
And so right now, this is impeding our ability to fight this virus in California.
I'm going to leave, I appreciate where you're going with that, and I appreciate the frame of your question. We want to test more people. We look forward to significantly increasing our testing capacity. This has been an issue in terms of providing more tests, and we hope it is resolved very quickly.
Governor, when it comes to education of students in the state of California, a lot of the districts that have either pulled back or talking about pulling back all seem to have this online component of offering classes. I'm talking about public school.
Yeah.
As what the next step may be, what they're informing parents about. What kind of conversations have been had about educational equity? Because a lot of students may not be able to have that laptop or Wi-Fi access at home, depending on their family makeup, where they live.
Yeah, all the above, and that's why I referenced in relationship to schools, school lunch program as a proxy for that point of view, and obviously geographic concerns, rural versus urban, dense versus communities that don't have the benefits of the components of social learning, or rather distance learning, online learning capacity and the like. So yeah, it's a point of real concern that those that can do and those that can't are unable. And so we've got to address that, and we're trying to do that, working with their superintendent. It's exactly, again, forgive me for belaboring this, why I met with all the 58 county superintendents to understand those nuances, complexities. 2 days ago, we talked about those complexities, not just being from a socioeconomic perspective in the traditional terms, but also through the lens of immigration and other lens that we have to look at. Transportation, geographic distribution, meaning concentrated districts, large districts versus small districts. I'll give you a specific. Just addressing meal hubs. It's easy in a small district. It's much more difficult in a large district. Where are those meal hubs? Are they going to be in libraries? Where can we provide parks, those points of access? Do you, for example, if you're going to have meal hubs to address the needs low-income kids, do you order online? If you don't have the capacity to do that, how do you then access those orders so you have a sense of what that need is? All of those things, I assure you, in real time, deeply through the lens of equity, it's what we do best in California, are being considered.
Governor,
Regarding your order on social or mass gatherings, and you mentioned the issue of enforcement. I mean, how do you sort of see the balance of power between the state and the local governments?
They'll do the right thing. I see people doing the right thing. I think we are hardwired, I believe, to do the right thing. And in all the conversations we've had with our local health officials, I think the vast majority, in fact, in the conversations, overwhelming, universal, said we're going to do the right thing. So we can be fixated on that, and it's a point of interest, and it might be a point of some consideration. It's not for me. Here's why. Because I know what I can do to address that in real time, and I don't think I'm going to have to do it. but I'm prepared to do it, so I know they're going to do the right thing.
What can you
But
do?
why not just take that step?
Because it's unnecessary. Why take a step that's unnecessary when people are naturally going to do the right thing? They've been directed, the executive order codifies it, and they said they'll do it. Many times you don't have to penalize people or even threaten to penalize them when they say, well, we're happy to comply.
So do you
Not a
expect
concern.
there to be like I mean, is this something?
It's already
long-term
happening.
We should go around and make
I-
sure these gatherings.
No, I'll repeat what for even more clarity. No, because I don't expect the need to do that.
What about, you mentioned earlier that Disneyland and like casinos are exempt. What about their situation is more complex to be exempted?
Well-
Say like the Dodgers or the Lakers or the Kings?
Well, Disneyland, I think, has 1,000 people on a ride every hour. They have concerts, they have theaters, they have parades. I mean, that's a nation state on a campus environment in Anaheim. I mean, that's a whole different thing. The complexity within the theater system is interesting as well. They are advancing some social distancing protocols. They're looking to stagger, just as your seats are currently staggered. The show times, et cetera, and new considerations of queuing, lines in their facilities. They're working with us in real time on those protocols, and they are providing hybrid considerations for us, and that's why we agreed to work with them to address those issues and to provide guidance with them. It includes casinos as well.
As far as amusement parks, it goes beyond Disneyland. Have you been talking like Universal?
Correct.
Six
Yeah,
Flags,
so
all
Jeff Shell, we've been in contact with all of them, and we'll continue to work collaboratively with them, but that is correct. Does not include amusement parks.
I asked you this last time. I mean, how is your administration and your close advisors, how are you guys functioning? Have you been tested? Has your family been tested?
You know what? I will test any other human being that's older than me. They deserve a test before someone like me deserves a test. So the answer is unequivocally, absolutely no. I have no symptoms, and you know what? Even if I did, I'd prioritize people that need it the most. The last thing we need to do in this circumstance is take care of ourselves without taking care of the people. And so my priority, my administration's priority is you first. But that said, I care deeply about our team members and care deeply about their families, and they're doing common sense things that you are doing, and they are practicing what we're preaching in real time, including on the issues of how best to conduct the business of government. And as I noted to you 2 days ago, CalPERS and others are already doing that. In fact, I think we have today our Future of Work Commission. Now, one person is in the same room, so we're already practicing. Forgive me, Zoom just got a little nod. We're using Zoom to bring everybody online, and so that's just one of many examples of what we're doing, the kind of things you and I, everybody else should be doing.
So
Are
to
your
that
kids
end,
still in
how should
school?
things happen here in the Capitol? I mean, this is a place of mass gatherings. That's
We're
the
working,
nature of-
yeah, we're working with state parks on tours, and we'll have some guidance very soon on that.
But there's school groups walking around, there's 100 people up in the health committee.
That's
right
why
now.
we're working with state parks, and we're going to give you guidance on that in real time. We're working with legislative leaders in real time. You saw the pro tem put out a press release. We are working with her. The Bagley-King components, the Brown Act components were essential in terms of them moving to the next step. Those were afforded officially in the executive order last night, and in real time, we'll address their needs. But let me say this. We won't just address the needs of elected officials. We'll address the needs of the janitors here. We'll address the needs of the workers here, the folks that are in contact with more people than anybody else, and those, the security that's afforded here. Everybody deserves that same level of consideration. So there is no hierarchy here. There is no protocol that puts any of us above anybody else. We have a mandate to the people of the state and the most vulnerable. Our priority is for the most vulnerable, and I have confidence that you will have clarity within the next number of hours, perhaps as early or as late, rather, as tomorrow morning, on details about how this place runs. But I honestly am more committed to the 40 million people that don't reside in this building.
There's other places too, right, like courthouses where people feel like they have to come because they have a court date.
Essential.
Essential, right?
Essential
So-
versus non-essential, and that's what we distinguish.
Essential, obviously, and that's been excluded from this to some extent, but how do you ensure that those places continue running as we move forward through?
We're working with the courts, we're working with our partners, let me extend your considerations, this may be of interest. Our jails, our prisons, protocols on visitors, essential versus non-essential visits, All of those things are being considered in real time. There is not an hour that goes by, hasn't in the last couple weeks, where we're not on a conference call with partners all throughout the state of California in every capacity of government, at every level of government, trying to work through the anxieties and the logistics in these spaces.
Governor, another question related to where we're going as a state. So obviously Italy is behind, or was ahead of us by a few weeks. They're now in a full shutdown. So can you give citizens a sense of what the next steps are, what comes after this, and what they should be preparing for broadly?
Well, the most important thing, it's one thing to take a piece of paper and to fix your signature to it. It's another to apply its intent. So it's in the application now that I'm most immediately focused on of the guidance that we put out last night in the executive order. I continue to posit that it's decisions, not conditions, that will determine our fate and future as it relates to COVID-19. We have agency. We can change the future. It's not something to experience, something to manifest. So it is in the sum total of our individual decisions that we will determine the fate of this virus. We will meet or not meet the moment. I have confidence we'll meet the moment. And so we want to make sure we apply the principles of the social distancing. We want to make sure we secure the needs of our most vulnerable populations. That's why, again, it's not 250, it's 10. We are prioritizing our assisted living facilities, our congregate care facilities, disability communities, which is another big and under-focused area of concern, and making sure that we socialize this in all 480-plus cities in the state and 58 counties in a way that is as consistent as we can make it. Then we will move to the next iterations. I remind you, I said it a couple days ago, that we're running scenario plans. You're going to see these numbers increase. We've been saying this. I know Dr. Fauci said it yesterday. Everyone thought, wow, I had no idea this was coming. Of course, none of that should have been a surprise. We've been saying numbers will increase as we start testing more and more folks, and we move from a framework of, trying to track and trace every single point of contact to more of a containment framework. And that's what phase we're in currently, and that's the phase I think we'll be in for a little bit of time. And to the extent we have to prepare for extremes, that's the commandeering component of the executive order. That's the securing of the hotel resources and motel resources and state park resources that have hotel and motel components. That is already underway. That 120-bed hotel in San Carlos, we're not going to fill that up today, but the reason we wanted 120 beds is to the extent we need it. We are looking at old mothballed facilities, including hospital sites, to potentially take them over, to scrub them, get them up ready in case we need them, and we're willing, to be fluid in this. Let me talk about fluidity, and forgive me for belaboring this. This is just important for folks to know. We, as part of the dynamic of considerations in real time and what is happening, not what we thought was going to happen, we, working with the mayor of Oakland and the port director of the Port of Oakland, they have been spectacular, by the way. That's what partnership is all about. They felt it appropriate, working with the State Department, working with the CDC, ASPR, which is that under HSS, which is the coordinating body that is point with our operation for the Grand Princess, to continue to site and to port the ship through Sunday. We were going to send it back out to sea today. Everyone felt it was just unnecessary to do that, even though we have gotten all the Californians off, and we'll get substantially everybody else off tonight, save a few foreigners that we are still trying to get back home and get them on appropriate flights. But because there are a few foreigners and are not on there, and because we are looking to get those crews back to their home countries like the Philippines, Japan, South Korea, India, and other places, we felt at least through Sunday we would just keep the ship there. That is something, again, all of us concluded was appropriate under the circumstances. And is this an example of the nature of how you need to prepare for anything?
Governor, why isn't the Surgeon General here? You created that position.
Well, we're in constant contact. We could have about 150 people here, and that wouldn't even do justice to the number of people that are operationalized currently. But she's out, she's talking to our private sector partners. She's actually helping us secure resources. We've got a whole team on innovation. Folks coming in with testing kits, this protocol, that protocol, people from around the world sending things. She's assessing all those things. She's done a magnificent job.
Governor, are your kids still in school?
They are.
And also, do you think that public health response has at all changed because of like limitations on testing? Is it being designed around that?
No, I mean, I have no sense of that personally. I've not heard that from any of the superintendents. I didn't hear that from our superintendent of public education. I haven't heard that from principals and teachers that I've been in contact. I'm not concerned about that. To the extent that becomes an issue, we will immediately disabuse people that it should be an issue. Public health, public safety, first and foremost. We can always make up for these moments later.
Governor, you said a couple days ago you were going to look at your options for, I guess, stopping cruise ships from docking in California. Have you done that? Have you made any?
Well, one better, Princess announced they're suspending all cruise ships for the next 60 days. To their credit, Viking immediately responded in kind. To their credit, we hope to hear other announcements similarly throughout the rest of the day and the next few days. That's very helpful.
And also, do you have, I mean, for gatherings of less than 250, I mean, there's a lot of things coming up. You have it's wedding season, it's high school prom season.
Yep.
What's your advice for people, parents, kids, for things like that?
Common sense. Again, it's for seniors, for people with compromised immune systems. Avoid those events. Common sense. We lay out our guidelines in detailed terms of how one should conduct themselves for events that are deemed essential or even non-essential events less than 250, on social distancing, on sanitation practices, what those protocols and procedures should look like. I laid out in detail what we believe the school systems should be doing. Workforce, we expect the same in terms of how desks and tables are organized. Outdoor venues, we distinguish from indoor venues. If you're in a meeting hall in a basement, that's very different than being out in a large public park. And so all of those things have criteria and consideration that have to be tailored through the application of something that is available to all of us and is a renewable resource, common sense.
Governor, in your
Why, forgive me, talk to me a little bit about why card rooms, casinos are kind of getting a pass.
I'm not getting a pass, and I tried to be as clear as I could in real time, working through the distinctive nuances of some of these larger parks, amusement parks, how the queuing and lines work, what kind of mixing occurs, how we're addressing their unique needs. We are very soon. We put this order out a number of hours ago. I can assure you, you're going to get clarity on this. And I don't want to say in the next few hours, but we are working overtime to tighten up all of those considerations. I laid out as an example, not just some of the large amusement parks, but the theater chains that are already, and they provided us more information about what they're already doing and are about to announce that allowed us to step back and say, all right, with those considerations, let's keep working on any ambiguities of consideration. But I assure you, we are leaning in. We're not being passive. I think we're meeting the moment, and we're not going to allow people to be separate and above if it puts the health of the people of the state of California at risk.
As the testing situation,
Oh, sorry.
Sacramento and other counties have ended recommendations for 14-day quarantines as part of the mitigation strategy. At what point would it make sense for the state to also end that recommendation?
Well, we'll make that determination, but I can assure you we didn't believe that appropriate for those repatriated on the Grand Princess. We felt they should be quarantined on the military basis. Not everyone felt that way. There were some health officials that felt they could home quarantine. We didn't think with the totality of people coming off that ship. Remember, we started with 2,421 passengers on that ship. We felt the system was not prepared to absorb that. So we'll make those determinations in real time. County by county, they're making determinations based on community spread, based on the current conditions within their counties. They are all working hand in glove with Dr. Angel, Dr. Galley, in terms of recommendations, protocols, procedures, and we in turn, of course, very directly with the CDC. So that's the fluidity, that's the dynamic of those decisions.
as the testing situation
situation improves in the state? If we were to have another cruise ship situation, would the goal be to test everybody on board before you let them?
I think the most important thing we did, and Dr. Red, who was part of the Diamond Princess efforts versus the Grand Princess, this is the model, not the Diamond. They tried to quarantine people in that ship for that 14-day period. More people came into contact with the virus as a consequence. You want to get people off the ship as quickly and effectively and efficiently as possible in a way that doesn't just impact them, but the community and communities you're bringing those people into. And that's a combination of the protocols and process and procedures. So it would be my intent, unless those tests can't be done within minutes or hours, that we remove people as quickly and efficiently off the boat. But we hope not to be back in this position, because I can assure you, this has been a large operation. It has been deeply time-consuming, but in the process, we've developed some very strong relationships with our federal partners, and that is going to make us stronger moving forward and more capable. But we don't need many more of these cruise ships coming in on with these kinds of repatriation processes. Sorry.
You indicated last night that you were going to do something to sort of help the businesses who are going to be impacted by your executive order on, canceling large gatherings. Can you give us a sense of what you're planning?
Well, the unemployment insurance indirectly impacts sick leave, will indirectly impact tax, will be not only for individuals, but the tax waiver of penalties and fines is also for businesses. So those are just some pragmatic, specific issues that were laid out in the executive order I signed out last night. We are working very collaboratively with Speaker Pelosi, who's been magnificent. She has our back. She has the American people's back, but substantively, folks in her district and in the state, and she's been deeply connected, not just individually with me, but her team and our team on where we can best utilize federal support that would help address the anxieties, particularly of small and medium-sized businesses, particularly in the service industries, the hospitality industries that will be disproportionately impacted, specifically wage earners that don't have the benefit of unemployment insurance and in benefit as a workers' comp, do not have retirement benefits that they can access and the like. So you have folks that are part of our contribution platform economy, the gig economy, broadly defined. You have folks that are independently working 1-2 jobs as a waiter here, busboy there. Those are the folks that we are most sensitive to in terms of needs. And we have Lenny Mendonca here, who runs our economic development work in the state, who has been working 24/7 to try to organize our requests to the federal government, and is working with Keely Bosser and our finance team to the extent the state can provide appropriate support. But the state did, in that process, develop the framework for this executive order that begins to help support those in need.
Governor, is the cruise ship industry paying for any of this, the cost?
Yeah, we'll assess the cost. Trust me, we have a detailed ledger of costs associated with this, and local, regional, state. Oh, come on. We're not prepared to answer that question right now, because those dollars are happening in real time. We're focused first on public safety, public health, but we'll have those numbers. And to the extent, cost, I can assure you, this was substantive the conversation I had with the President of the United States and the Vice President, that's not a factor as it relates to taking care of American citizens. It was never going to be a factor with the repatriation of those 6 flights, not ships, that originally came into the state of California. While those may have been discussions, we were absolved of any anxiety related to those repatriation missions. That's not an impediment in terms of doing the right thing.
Some people have been very critical of President Trump and his administration's response to this pandemic. You have been very critical of him on other issues, but not on this. Why?
Because I'm working to solve problems, not create problems. I'm willing to put aside our differences on a lot of issues to meet this moment so I can meet the needs of the people of the state of California. And I think we're better off when we're working partners, not sparring partners. And I call balls and strikes. I think you guys have heard that from me on ad nauseum occasions related to wildfires, related to earthquakes, and I've been consistent. When we are working well together, I express it. When we're not, I'll express it. And I have nothing to say to create a wedge, because I would be lying to you. I'd be making something up to fulfill some political lane or some political purpose. And I'm not here to solve for politics. I'm here to solve for public safety and public health.
We have a question on the phone, Governor, if you don't mind.
Okay, thanks.
We have Laura Mahoney of Bloomberg Law.
Hi, this is Laura Mahoney of Bloomberg Law. Hey, are you quantifying or looking at what the economic impact would be to state revenues? And then are you considering any kind of other economic stimulus type measures to address the downturn in the economy that this could?
So it was just a few weeks ago. Let me answer that specifically, but first let me contextualize the world we're living in. I gave my State of the State a few weeks ago. I made the point where I have 119 consecutive months of net job growth, record low unemployment, record reserves, bond rating that's the highest it's been in 2 decades, and running an operating surplus that we estimated conservatively at $5.6 billion. I mentioned 48 hours ago that we had anticipated a slowdown in the growth of the American economy, and we had referenced, or rather, we had incorporated that into our January budget. I referenced to a number of you individually, now I'll do it as a group, that our December and January numbers as it relates to the S&P and where we thought the markets would be are actually higher than we had projected in our January budget, and that we had a good month or two of cash revenue that exceeded some of our early projections. We are uniquely positioned to meet this moment. That said, the economic disruption is profound and it is real, and clearly it's going to have an impact on our state treasury. Too early to determine what impact. You watch the markets like watching, whatever you watch, but it's, when I sat down this morning, it was down 2,000. When I got out of the meeting, and 10 minutes later, it was only down 1,100. So if we live in that moment of anxiety, then my answer may change moment to moment. But I can just say this. As of yesterday, we're about 12% off our projections on the S&P. As I noted, the S&P was about, 3120 is where we expected to be at the end of Q1 of this year. It's obviously not at 3,000, not on 3,100. But 12% is not 70%. It's not even the 20% that was identified through the bear market identification yesterday. So we're assessing that. Again, we're in a unique position. California is a nation state. It's a dynamic economy, but it is an international state in this respect. We are interdependent. And trade and commerce in our ports of Long Beach, ports of LA, obviously we're number one in two-way trade, number one in manufacturing. That is going to impact the state of California. No one's naive about that. And of course, we are a dominant tourist economy. Hotels, restaurants will struggle. All the conferences, tech, and the like that are canceling large conferences, all that will have an impact. All that will be assessed, but I'd rather be in our position, candidly, than many other states that were already running deficits and already running in the red in terms of the general direction of their economies.
So are you revisiting yet any of these kinds of
Everything is being
programs and
revisited
things that you
in real time. You can imagine that Keeley is not just saying, hey, I'll come back in May and then we'll think about it. She is meeting with people 24/7. Lenny and his team have brought in the best and the brightest minds from across the country, quite literally. And when I say that, that's not one of those political throwaway lines. I mean some of the leading economists and experts in the United States that are advising Lenny, advising our budget team. And we are running scenarios not just on pandemic planning, public safety, public health, but also on economic conditions. And the wonderful thing about standing here in March and not in June and July, or worse, August, is that we have a revise coming up that was going to happen on the natural, and now will happen with all of this benefit of new information, and we'll meet the moment.
Governor, I know obviously we're in this right now, but initially, how do you think the state's response is comparing to past, health emergencies, SARS?
I think we're doing I can't, I've been here, 8 years, 9 years now, lieutenant governor, so I don't have the benefit of decades ago, but I do have the benefit of former Governor Schwarzenegger providing me information of considerations as it relates to our pandemic plans and some of his unique experience. I've had the ability not only to talk to him about that relationship to pandemic planning, but subsequently wildfires. Governor Davis, the same on wildfires. Clearly, obviously, Governor Brown, and being a student of our reactions in 2015, 17, and 18, as we had the three of the worst wildfire seasons we've had in our history. We're second to none. And I say that because we have an all-hazards approach to suppression, mitigation, and recovery. And what that means is we don't just look at issues of wildfires. We consider wildfires and PSPS. We consider wildfires, PSPS, and earthquakes. We consider wildfires, PSPS, earthquakes, and pandemics. And the protocols and logistics and the operational construct is very similar in those responses as they are in this response. That's why Mark Garaducci is point down at the Grand Princess, working on logistics, his partnerships, hand in glove, not just with FEMA, but with the federal military personnel, working on these Air Force bases for other reasons and purposes. So I feel like the state is doing everything it can, and there's always areas for improvement. You'll find them. We'll find them before you find them. We'll own up to them, and we're constantly iterating. And as I said, I'm not happy with seeing some of the social media, some of those 60, 70-year-olds sitting on a bus waiting an hour, that's and not getting their essentials. But we're trying to, in real time, improve upon all that.
So on the question of who's in charge, if we get to the point where, hospitals have to create standards for prioritizing who gets a ventilator, who gets a bed, if there's so many sick people and the healthcare system gets overwhelmed, is the state in charge of setting those standards and making those decisions? Are you deferring to your local governments? Well, how does that work?
We have federal partners. We have the state expertise, state overlays, but we have plans that already play out those protocols in detail. We believe localism is determinative in terms of understanding the conditions on the ground. I say we're a nation state. What do I mean by that? That we are many parts, but one body, but we are many parts. Rural parts of California, Northern California, are very different than some of the central, some of the larger urban centers in other parts of the state. And so conditions, criteria, their assets, their resources, human resources, physical resources are different and unique and distinctive. And so what we do is we are informed by locals, and then we supplement our support with the state and federal government, and we work hand in glove collaboratively. But in each instance, we have incident command protocols that are very prescriptive and well established. As I related to you on multiple occasions, including today, ASPR is the organizational construct working with the CDC that's incident command on the Grand Princess. So you look at that hierarchy of prioritization depending on what the incident calls for. So as it relates to a cruise ship, it calls for certain command structure. As it relates to, and we'll have to fill in the blank in your scenario, we will have similar construct that is well established and resourced by personal relationships that frankly are more important than anything that exists in a large binder. And that's why I'm very grateful for these folks that are on the phone 24/7 building trust at the local level.
Last question, if there's one.
Well, I'll take advantage of that. Thank you all. I hope to never see you again, but for the better and more enlightened reasons, but we'll probably see you tomorrow. So thank you all.